Welcome back. Today we're doing a deep dive into the thyroid gland, sort of the body's little engine room for energy. We're using insights from health guides, particularly those shared by Blood Test UK.
That's right. And we really want to focus on why testing this gland is so helpful for you. What are the actual benefits? And also, what does it mean now that testing is, more accessible? Thinking about those local resources, like the ones mentioned for Sutton Coldfield.
Okay, so let's break it down really simply. This gland, the thyroid, it makes hormones. T4 and T3 are the big ones. Think of them like the controls for your body's speed, how fast you burn energy, body temperature, even your heart rate.
Exactly. And when those controls are off, either too high or too low, it really affects almost everything. It's not just one little thing.
Right, and there's another player, isn't there, TSH?
Ah, yes, TSH. Thyroid stimulating hormone. That's basically the message from your brain telling the thyroid what to do. If TSH is high, the brain is shouting, hey, speed up, because the thyroid isn't doing enough. If TSH is low, the brain's whispering because the thyroid is already going too fast.
Okay, so if the thyroid's too slow, that's hypothyroidism. What does that feel like?
Yeah, hypothyroidism. You'd likely feel tired, really sluggish, maybe cold when others aren't, and possibly gaining weight.
And the flip side, too fast.
That's hyperthyroidism. Feeling anxious, maybe jittery, often feeling hot, losing weight without trying. It really impacts your mood your whole day.
Both sound pretty disruptive. So let's talk benefits of checking. The Blood Test UK info highlighted catching things early.
Absolutely. That's probably the biggest benefit. Catching it early means treatment is usually much simpler, much more effective. But here's a really key point from the sources of these symptoms. Feeling tired or anxious, they often get mistaken for other things, like just stress or maybe depression.
So you might be treating the wrong thing entirely.
Exactly. Testing TSH, T4, T3. It makes sure, if the root cause is metabolic, thyroid related, rather than purely mental health. Getting the right diagnosis is crucial.
That makes sense. Now, about getting tested, you mentioned local resources, like in Sutton Coldfield, highlighted by Blood Test UK. Is it getting easier to actually get these tests done?
It seems to be. The guide mentioning specific areas like the West Midlands suggests accessibility is improving. And that's important because sometimes getting that initial test ordered can be, a bit of a hurdle.
Right.
But with more accessible options, maybe like those in Sutton Coldfield, it empowers you to take control. Plus, hormone levels aren't static. They can change.
So regular checks help personalize things.
Precisely. It allows for managing your health based on your current levels, not just a guess. Personalized management, that's key.
Okay, what about lifestyle? Does the guide mention simple things we can do to help our thyroid engine run smoothly?
It does. Simple, practical stuff, like getting enough iodine that's often in fish, dairy products, and selenium is important too.
Brazil nuts are good for sleep, right?
That's the classic example, yeah. Just a few can make a difference. Also, managing stress things like yoga or just relaxation techniques. And movement, exercise, helps with mood and weight, which are often affected.
Good, simple tips. And the test itself, people might worry about that.
Oh, it's usually very straightforward. Just a small blood sample, typically from your arm, quick, generally painless. And the results, like that TSH level we talked about, give your doctor immediate clues. High TSH likely means a slow thyroid. Low TSH suggests an overactive one. It points towards the next steps.
So pulling it all together, what the sources from Blood Test UK really show is that knowing your thyroid status, using these accessible tests, gives you real control, doesn't it? Control over your energy, your mood, your overall health.
It absolutely does. And that leads to maybe a final thought for you, the listener. We know these thyroid issues often run in families. So if you have a family history, even if you feel okay right now, ask yourself, when was the last time you had it checked? Especially since the general advice is often to start checks around age 35, maybe every 5 years or so. Something to consider, definitely.